It's my great pleasure to attend the MOU signing event.
I'm delighted to celebrate this exciting new collaboration.
And this is precisely the whole objective of our collaboration.
That we communicate effectively why public health is important, and we train the next generation of global health leaders.
That to me is extremely important.
From Hong Kong, thank you for joining us and welcome to this special event toward a brighter future, collaborating to advance global health security, a special and new collaboration between the Harvard T.H. Chan School of Public Health and the Tsinghua Vanke School of Public Health. I'm James Chow. I'm here in the beautiful rooms of the Asia Society Hong Kong Centre. It's a joy and an honour to moderate this event. We are joined today over at Harvard University by Provost Alan Garber and over at Tsinghua University by Vice President and Provost Yang Bin. And here in Hong Kong, beside me, we're joined by Dean Margaret Chan of the Tsinghua Vanke School of Public Health, connecting to Boston, where you're joined by your old friend and ally, Dean Michelle Williams at the Harvard T.H. Chan School of Public Health. This must feel less like work, sometimes more as an alliance towards securing the health and happiness of people everywhere.
Professor Yang Bin from Beijing, and I also would like to welcome my good sister, Michelle.
Hello, Margaret, my sister. Good to see you.
Well, today's a very special day, and we'll be looking forward to hearing from both deans engage in conversation about the very issues that are shaping the world today. As you said, we're joined over at Harvard University, but first we're going to turn over to Tsinghua University in Beijing by Vice President and Provost Professor Yang Bin.
It's my great pleasure to attend the MOU signing event between Harvard Chan School of Public Health and Tsinghua Vanke School of Public Health. Tsinghua and Harvard have a long history of exchanges. We have extensive cooperation in business administration, public administration, medicine, environment, energy, and other fields. Today, we are very happy to gather together again to witness a new collaboration between our two universities in the field of public health. Health is a foundation of social civilization and progress, and a priority goal of public policies of all countries. Promoting global health is important to the implementations of the UN's Sustainable Development Goals. However, the seemingly unending COVID-19 pandemic has exposed not only the fragility of global health system, but also a lack of coordination of global responses, which leads to a fact that we have been massively distracted from the important Sustainable Development Agenda. Last month, Tsinghua University, with the support of the Vanke School, initiated inaugural World Health Forum. Today, the Vanke School will join hands with one of the top public health schools in the world. Just as Professor Lawrence Bacall mentioned during his visit to Tsinghua in 2019, universities should not only be committed to advancing human knowledge and research, but also contribute wisdom and solutions to the common challenges facing mankind. I hope the two schools will take advantage of their respective advantages in public health to boost shared development and progress, to promote friendly exchanges between China and the United States, and I encourage faculty and students from both schools and universities to fully use this collaborative platform to share new knowledge, to tackle common public health challenges, and to jointly make our world a healthier place.
We thank Vice President and Provost, Professor Yang Bin, for speaking to us. And Provost, it's very reassuring to hear you talk of human health and well-being as one, not as separate entities. Thank you very much. Let's go now to Boston, where we're joined now by Harvard University's Provost, Professor Alan Garber.
I'm delighted to celebrate this exciting new collaboration between the Harvard T.H. Chan School of Public Health and the Tsinghua Vanke School of Public Health. This collaboration is timely for two very important reasons. First, global health challenges require global solutions. The devastating spread of COVID-19 around the world has demonstrated how closely our fates are linked. Nations cannot afford to turn inward. We must work together to overcome this pandemic and those that will inevitably follow. Climate change is another critical challenge with enormous consequences for public health. It exposes us all to increased risk, whether from new pathogens or from the lack of clean air, safe drinking water, and sufficient food and shelter. We need to think creatively and collaboratively for the sake of our planet and the health of humankind. Second, we welcome this collaboration because it will further our goal of training the leaders of the future. We know that our colleagues at Tsinghua feel just as strongly about the importance of our educational mission. As we train our students, we seek to expose them to the best minds and ideas from around the world. We strive to teach them how to collaborate across boundaries. The agreement we celebrate today will help both the Harvard Chan School and Tsinghua Vanke train the leaders we need to guide the global health agenda now and for generations to come. Dean Williams and Dean Chan, you have laid the groundwork for an important collaboration. I look forward to seeing all that you will accomplish together.
Professor Alan Garber, thank you very much for your good words at this time. Let's go now to our fireside conversation and engage the two deans in what I hope and I'm sure will be a dynamic debate on what some of the issues are today, how they link to public health, and how we can create good solutions out of all of them. So to Dean Chan here in Hong Kong and to Dean Williams over in Boston, I suppose a good way to begin will be to ask you both, given that this is a special day, a day in which we honor a new collaboration between your schools, what will this mean for you, but also to the communities that you serve each day?
I welcome this collaboration with Dean Williams. We are good friends, and I would like to take wisdom from the two provosts of Harvard Chan as well as Tsinghua University. Both of them mentioned the importance of working beyond your national borders, working with other countries, talking about the importance of cooperation and coordination in this partnership of collaboration. There's a lot of hard work for both of us, but I'm committed to that, and I'm sure, likewise, Dean Williams, you would do the same.
Absolutely. Let me just say, my good friend Margaret, it matters a lot to me that our provosts from our respective universities and each of us share the common vision that is born out of the understanding that the challenges that we face in public health require partnership. It requires partnership among academic institutions, such as what we are celebrating today, but it also requires an intentional commitment to partnering with other institutions in the private sector and the public sector to be sure that the solutions necessary for the threats to population health are brought forward in ways that unlock all of the potential to improve, to protect, to promote, and to preserve health and well-being.
When we talk about health these days, we also talk a lot about innovation and using the emerging technologies to respond to the changing needs of the 21st century. Is there one such technology that excites you both?
Well, to be frank with you, James, let's use COVID-19 pandemic as an example. First, the scientific community has delivered all the tools that we need to tackle this pandemic. You know, the scientists analyze and has the ability to decipher the genomics. From there, we have the tests, we have the vaccines, we have the therapeutics. So I would like to thank them. The second innovation reminds me is that look at the way how innovation is being used to manage COVID-19, particularly in China, that I know better. China, you know, because of digitalization, the advancement is really taking leaps and bounds.
What's exciting also is that Tsinghua and Harvard are two cradles of innovation. So Dean Williams, from where you sit over in Boston, is there something that you see that moves you, not only in terms of excitement, but also in terms of emotion?
You know, Margaret's response reminds me of just how critically important it is that our schools are embedded in great universities where engineers, life scientists, physicists are working in preparing that seed corn for the innovation in technological innovations to occur. I'm excited about all of the new advances in computational sciences, you know, using artificial intelligence methodologies and machine learning methodologies in the computational space. I'm excited about how we have transformed how we can produce vaccines using the mRNA platform. I'm optimistic about how CRISPR will help us in the biomedical spaces. But here's what attenuates some of my enthusiasm, James, and that is these technologies, when they come forward and they are helping us solve problems, we have to be mindful of the disparities gap that can happen if we are complacent about how these assets, these fruits of our science are distributed. Yet to optimally bring these tools forward to vulnerable populations.
We're not only into a third year of this pandemic, but in the last days, we've been speaking about a new variant as well. How are your schools addressing the key public health challenges of our times?
Michelle, you talk about the importance of interdisciplinary collaboration, and I fully agree. But we need to go back to basics. You talk about also inequity. We have the tools we need to control this pandemic, and yet, for many reasons, countries are not making full use of the scientific innovation. Can we teach our students about inclusiveness, about tolerance, about collaboration, with the global village? And this is, what excites me is about this collaboration is that Harvard Chan, your long history is something we need to learn from. Vanke School in Tsinghua University is new. We are the new girl to the block, I used to say. But we have a keen sense of urgency and responsibility. And we look towards this collaboration, and that will bring a much better future for our young generation and beyond.
One of the key important aspirations of our collaboration is ensuring that the next generation of public health practitioners have strong leadership skills, that they are positioned and prepared to engage in global health diplomacy. And I just want to put my good friend Margaret on the spot here and say, I am so excited that the educational opportunities that are presented by our partnership of engaging with Margaret and her faculty who are focused on population health, governance, leadership, and ethics are so well aligned and synergistic to what we have to do as educators for the next generation of global public health leaders.
One thing I learned in my previous life, working in the World Health Organization, is you need to be tenacious, but governance, I want to thank you. Governance is important. Why? We need to have the rules of the games set out right at the beginning so that every party who joined this collaboration through the coalition that we are going to talk about, we need to mark them, assess them. One thing I learned in WHO is, words are cheap. Action are more valuable. Whether or not we can keep up with our promises. If they cannot deliver, they need to explain. I'm committed to this collaboration, Michelle, and I will follow your leadership, and let's move it along.
Well, I know when you speak about inequity, which is something that you so often speak about, Dean Chan, there has to be a powerful gender component to it as well. And at the World Health Organization, you champion the rights of women and girls throughout your 10 years as the Director General. Dean Williams, we spoke a couple of months ago and you talk very movingly about your own experiences being born in Jamaica, then moving to the United States and benefiting from the education that New York City public schools are able to afford you. When you look at COVID-19, when you see how girls and women and other people are crying out, not only for leadership, but sometimes just access to health services, what do you think should be done? What must be done to protect their health, to put that first and not as a footnote?
This matters a lot to me. I will say to you that one of the most shocking statistics I learned just in the last few weeks was a report from the World Economic Forum. It was their 2021 report. And they report that they report on the global gender gap index. And just since this pandemic started, we have lost almost 40 years, exactly 39 years of progress in closing that gender gap as a result of the economic, health, and social devastation of the pandemic. What this single statistics tells us is that there are still major vulnerabilities across gender line, racial and ethnic lines, immigration status lines that we have to be mindful of. We have to think of those who are vulnerable among us. And the ways to think about this is to appreciate that 80% of the determinants of our wellness and health are social determinants. And when we realize this, that public health is your health, it's everyone's health, it's your family's health, then we have to make strategic investments in the social safety nets that I personally benefited from and my family benefited from, that allowed us advancement and stability and resilience.
You're not just both women deans, but you're also both women of color. I'd like to get your perspective on how the COVID-19 pandemic has surfaced health inequities locally, but also in the global village that we speak of. Can you share with us more on what's happening on the ground and what is being done to course correct the problem that we see around the world today?
I've been working with so many infectious diseases. Some 40 years ago, it's HIV AIDS. And then in between, there are SARS, there are, H5N1, and there are Ebola, and now we have this COVID-19. One lesson is important for us to understand. You cannot hide communicable diseases. Number two, communicable diseases go across boundaries. Number three, communicable diseases does not recognize race, religion, and colors. So this is important. We are together in this. But let us not forget, we reverse the achievement in 40 years just because of one communicable disease.
What we take away from the 40 years of our experience with the response to HIV AIDS is we have invested in people, platform, and partnerships. And these investments pay dividends for threats that we have been around for a long time, malaria, other STDs, for emerging threats like a new pandemic, and for persistent growing threats because of our demographic transition of a high burden of obesity-related disorders, diabetes, hypertension, cancers. So when we think about solutions to health threats, don't think in siloed approaches, but think about a nimble platform that can be used to yield multiple benefits that we need to accrue in order to protect and promote and preserve health.
There is no vaccine and there is no treatment that can treat the disease of stigma and discrimination. I mean, you saw that up close for yourself in the 1980s when you were a civil servant in Hong Kong. What happened then? It involved a young child at the time.
As a junior medical officer, Michelle, I'd like to share this story with you. I was tasked to deal with a young boy. He got AIDS. And this poor boy was discriminated in school. He was unable to benefit from the education of Hong Kong. Not only him, but his family was discriminated against. And so I had to change their identity. I moved them to another location so that they will not be harassed by the unforgiving discrimination towards them. That taught me a big lesson about the importance of humanity. You need to teach people about the importance of inclusiveness, the importance about tolerance, the importance about differences, and acceptance of differences. That to me is extremely important.
I think what I can add is the appreciation for why some people, particularly African Americans in the United States, are resistant to comply with some medical and public health recommendations. Why is there concern about engaging in public health interventions, particularly among Native American, African American, and Hispanic communities? And it comes back to history, that historically these populations were not well served by the medical communities and the public health communities. And that historical memory of trauma that is passed down from generation to generation have complicated how they receive, interpret, and trust the message and the messenger who is trying to bring forward information that is life-saving for them and their families. We have to not only have scientific skills and acumen and technological tools, but we also have to have a huge dose of empathy, when we try to help solve problems. We have to listen first and be empathetic. And where it is important, reckon with the mistakes our institutions have made in the past. And it's only then, I think, that we can build the trust and earn the trust to engage with communities in a way that brings the collective response to our global health threats.
We began some time ago by speaking about what this collaboration between your two schools is going to mean for you both and for the communities you serve. May I finish by asking you, how do you think everybody in an inclusive approach can participate in this collaboration, whether they are directly involved in public health or not?
Quoting one of my good friends, the former US CDC director, Dr. Tom Frieden, when he attended the World Health Forum, he said, the world failed the COVID-19 test. And that includes the public health community. And Michelle and I are committed to really bring together the public health community, not only in US and in China, but beyond. And this is precisely the whole objective of our collaboration.
Let me just say that public health is your health. It is my health. It is our families, our communities, our nation, our planet's health. And I join Margaret in this deep commitment to doing all that we can as educators, as leaders of schools of public health, to be sure that we communicate effectively why public health is important, and we train the next generation of global health leaders who will be nimble and responsive and creative and collaborative in addressing the next set of threats.
Well, because of the unique aspects of the times in which we live with a global pandemic, we can't unfortunately gather the two deans in person in one place or the other. So we're going to do it in a new way, in a 21st century way, with Dean Chan signing here in Hong Kong at the Asia Society Hong Kong Centre and Dean Williams signing over in Boston. We thank Dean Margaret Chan and we thank Dean Michelle Williams. And most of all, we thank the leaderships of the two universities, represented today in Beijing by Vice President and Provost Professor Yang Bin, and over at Harvard University by Professor Alan Garber. And a big thanks also to the Asia Society Hong Kong Centre, to its chair, the Board of Trustees, Mr. Ronnie Chan, and also to its Executive Director, Ms. Alice Mong. Thank you.